And good evening. Thanks for being with us tonight. I'm Tim Seaman. It has been more than a year since the COVID-19 pandemic was officially declared over by the World Health Organization. But now, with masks off and social distancing in the past, diseases such as whooping cough are finding their way back into our communities. Tonight, KCAU-9 News reporter Alyssa Tatch checks in with local health experts about what they're seeing. The details in our top story at 6.
Thanks, Tim. According to the U.S. Center for Disease Control and Prevention, the United States is seeing a decade high in whooping cough cases, with more than 17,000 reported cases nationwide.
It's a bacterial infection that we haven't seen a lot of the last few years. For whatever reason, when COVID really went up, pertussis seemed to kind of go by the wayside.
In 2024, cases of whooping cough, also known as pertussis, have more than doubled the number of cases reported in 2023.
We always have pertussis cases every year. Prior to the COVID pandemic, we would have pertussis cases, and I think it's mostly just coming back to normal, at least in Iowa.
Because pertussis starts out like any other viral illness, most don't realize they have the infection until they get the cough.
When we talk about whooping cough, what we're actually talking about is 10 to 12 coughs with no breath in between, and then finally someone is able to catch their breath, and they finally, as they inhaled, it's like a, that's what you hear. That is what the whoop is.
While getting diagnosed early is a key to preventing the spread, our daily hygienic practices are just as important.
Good hand hygiene, even at young age levels. Again, it's really hard when kids are little to get them to understand hand washing and things like that, but a lot of our illnesses come from our hands.
Places like daycares or classrooms where illnesses tend to spread easily take precautions by cleaning every toy, chair, and surface every day.
Germs are coming out of their mouths, out of their noses all the time, and so they're going to sneeze on a table, they're going to sneeze on toys, they're going to wipe their hands on things. And so if you don't want it to spread throughout your whole classroom or your whole daycare, you have to do that.
But health experts say adults could be the biggest spreaders of whooping cough.
A lot of times adults will have it, and adults don't usually have the whoop. It's usually younger children that will have the whoop. And so adults tend to walk around with it, not really realizing what they've got.
Health experts recommend adults have at least one dose of the DTaP vaccine in their system to help prevent pertussis. From downtown Sioux City, Alyssa Tatch, KCAU 9 News.